notre pays a une capacité limitée des populations à accéder aux soins. Pas toujours parce que les soins ne sont pas disponibles, parce qu'ils ont la limite financière pour accéder aux soins. C'est pour ça que les taux d'utilisation des services, c'est très, très, très faible. L'expérience a prouvé qu'en mutualisant les risques et les ressources, on a une facilité pour acheter les services.
Community-based health insurance schemes are managed by the community. The members of the community can access health services without paying the full price of the service.
La mutuelle prend en charge l'hospitalisation et l'ambulatoire. Le malade paye 25% des prestations et la mutuelle rembourse 75%.
Je suis parmi la communauté. Je sais que si on adhère à la mutuelle, ça nous facilite les soins.
In 2009, the government of Mali requested assistance from Health Systems 2020 for the development of a community-based health insurance policy.
Puisque nous avons le document de politique qui prévoit de développer des mutuelles, nous avons dit donc qu'il fallait nécessairement affiner la réflexion par rapport à comment on va de façon volontariste développer les mutuelles.
The stakeholders decided to create schemes at the county level so that they have big schemes that can get a large number of members so that these schemes can be sustainable. The stakeholders, they recommend the government to give subsidies to the schemes.
En fait, le cofinancement, c'est quoi? C'est l'apport que l'État donne aux mutuelles pour que les mutuelles aient la possibilité d'avoir les ressources suffisantes pour se prendre en charge. Le 9 février 2011, le gouvernement, donc en Conseil des ministres, présidé bien sûr par le président de la République, a examiné et adopté ces documents qui ont été soumis.
In 1 or 2 years, the country developed a policy. The government decided to subsidize the premium, and now the process of implementing the pilot phase will start soon.
En adoptant la stratégie, c'est que le gouvernement a fait un grand pas. Et donc, il y a le témoignage d'une volonté politique.
Health insurance is something that is very important for people everywhere in the world.
Si tout le monde appuyait cette structure-là, la mutualité, et qu'il y ait assez d'adhérents, vraiment, ça fait du bien et pour la communauté et pour le centre de santé communautaire.
L'appui au système de financement de la santé est de plus en plus une priorité, et c'est de dire que nous pensons que le Mali est sur une voie où les partenaires doivent l'accompagner pour réussir ce challenge-là. Si on veut faire le développement, je crois que c'est un marathon et non une course de vitesse.
Welcome to an occasional cheese dip, a delicious mix of fact and opinion. I live in Taiwan. I've been here almost 4 years now, and this is what I've learned about Taiwan's healthcare system. Taiwan has national health insurance. The government provides coverage, collects premium payments, and pays providers for their services. This system was implemented practically overnight in the mid-1990s. At first, some physicians were reluctant to participate until they saw how popular the program was and then changed their mind. Now nearly every physician participates, and virtually 100% of the population is covered. Premiums are based on income. Those who earn more pay more, those who earn less pay less. A couple of years ago, in response to concerns about rising costs, the government chose to supplement the premium payments with a 2% payroll tax for all workers. Administrative costs for the program are about 1%, making it among the lowest in the world. I'm not surprised. For one thing, the country utilizes technology to manage the system. Everyone has an insurance card embedded with a chip. Medical information is centralized and analyzed. This not only makes it easier for physicians to access a patient's medical history, it also allows the government to analyze the data to minimize fraud. Those are some facts and figures. What about my observations and experiences? Well, making an appointment to see a provider is extremely easy. In fact, there have been a few occasions when I didn't feel well and just showed up at a doctor's office. One time I went 30 minutes before their closing time. I was in and out with prescription medicine in hand before the office closed. If you need a prescription, the physician will give you a 3-day supply of medicine before you leave. No need to make a separate trip to a pharmacy. The medication is included in the copay for the visit, and that's about $5. Many physicians operate their practices out of local hospitals. This makes it incredibly convenient should tests be needed. X-rays, blood tests, etc. are simply handled on site. The patient can go get the test taken, then return to the doctor's office to discuss the results. No need to take another day off work or visit another location. Even though most physicians can give you prescription medicine, Taiwan does have regular pharmacies. I've noticed, though, that their selection of over-the-counter medicine is smaller than what I've found in U.S. drugstores. My suspicion is that most Taiwanese prefer to seek professional medical advice rather than attempting to self-medicate. Visiting the dentist or eye doctor is equally convenient. It isn't unusual to see people sitting in a dental clinic at 8 p.m. on Saturday nights. The copay for a dental visit is only about $3. I will note that dental checkups are not as thorough as the ones I experienced in the US, and by that I mean they don't floss or polish my teeth. Then again, I can do those things myself. So what do doctors think about this system? I've read that some doctors complain about their payments. Then again, who doesn't complain about pay? I've talked to lots of physicians. Many of them tell me about how many countries they've visited around the world and the long vacations they've taken. So I don't think they're hurting financially. Most doctors I've talked with are proud of this system and the care they can provide to patients. Another telling sign about how good the system is that many Taiwanese people who live abroad maintain their insurance and return annually for checkups or if they experience health problems. This includes Taiwanese who live in the United States. Obviously, the health insurance doesn't cover everything. For example, I don't think cosmetic surgery is covered. However, it is widely available, and I believe Taiwan is becoming a preferred destination for medical tourism. Is the system perfect? No, I don't think so. But if you judge it on whether citizens have access to a reasonable level of health care at an affordable price, I have to give the Taiwan system an A+. So, that was a brief overview of the Taiwan medical system and my experiences. I think you would be hard-pressed to find someone in Taiwan who isn't proud of this system. So, thank you for watching an occasional cheese dip.